Welcome to Rehab Remix Reimagining Boundaries, the podcast that explores the future of orthopedic rehab within the construct of clinical innovation and digital health. I'm Rohit Nayak, co-founder of Band Connect, your host for this segment. Our goals are simple: to bring awareness to and energize our ecosystem to leapfrog the many challenges facing rehab today. Today, it is my privilege to introduce Brent Pekarski. Brent is a board certified clinical specialist in sports physical therapy, amongst many other certifications. Trained as a doctor of physical therapy at NYU, Brent is currently the director and supervisor of physical therapy at Druzinsky Sports Medicine Institute, operating under the University Hospital System umbrella in Cleveland. In addition to his PT rehab experience, Brent has experience working with a variety of athletes at all skill levels, looking at use cases such as return to sport, following operative and non-operative injuries. Notably, he has been one of the catalysts helping Band Connect expand our addressable use cases to include youth athlete conditioning, injury prevention, and return to sport. Brent fits the profile for this discussion for many reasons, as you will find out. Brent, thank you for taking the time to be here.
Absolutely. Thank you for having me on.
I'd like to start on a very broad note. I was hoping you could provide our audience a quick glimpse of your journey in the rehab world and subsequently your engagement with sports and youth athletes as well.
Yeah, so, I don't have the typical story of, playing a lot of sports when I was younger and getting injuries and being in rehab and then wanting to be a PT, but I do kind of have a background in sports and exercise, and I kind of wanted to figure out, what profession could I do that still involved me in those realms. And I was always pretty good at like the health sciences, so that's kind of what opened the door to physical therapy for me. Even going into, undergrad and then into graduate school, I always knew that I wanted to do something that was more sports based. But, all our professors would always tell us, hey, that's what everyone thinks when they get into school. But then by the time they get out, they really switch and they want to go to neurology or pediatrics or, inpatient or whatever it might be. And I pretty much knew the entire time. And once I got out that, hey, orthopedics and sports was really the realms I wanted to be in. So really, once I got through school, I helped start an outpatient private practice in New York City, kind of working more cash-based services. And at that time, I kind of realized that I really wasn't getting as many of the sports populations that I wanted to. So I then also decided to work part-time at a sports physical therapy clinic in New York City. My wife and I, we enjoyed our time when we were in New York, but we knew we wanted to start a family sometime. We're both from the Cleveland area, which brought me back to Ohio. And at that time, I had some connections with some of the physicians and some people that worked at university hospitals, which just really made sense to kind of try to get in the hospital system there and work with some people that I already knew. And I was really fortunate that, in the coming years of me being at university hospitals, they built the Druzinsky Sports Medicine Institute. And with, my relations with some of the physicians and board certifications, and I also assisted us in starting our sports physical therapy residency program. It kind of made sense for me to be at the new Druzinsky location. And some things that I didn't even know were going to kind of fall in my lap with that was the opportunity to be involved with research. And specifically, we are really looking at a lot of tech companies with sports medicine. It's really kind of where I would say myself and some of our sports medicine doctors are really trying to do most of our research, which has kind of led us to meet and kind of led me on this path of really trying to be at the forefront of how we can utilize technology with physical therapy and with the athletic populations.
Cool. Thanks for that. You know about Band Connect's emphasis on a blended or hybrid care model that builds upon the clinician-driven in-clinic experience to drive whole care, hybrid rehab, as we call it. You were one of the earliest to dissect its value. And as I mentioned in my introduction, quick to bring up the youth athlete injuries as a need. Can you expand on this?
Yeah, so I would say, our first experience with trying to do anything hybrid or virtual kind of came with COVID, just because telehealth became a little bit more popular or well known during that time. And I think that really opened the door to the possibilities of being able to provide a quality service to patients, even though you might not be in the room with them. So not only does telehealth but the ability to also incorporate anything into their home exercise programs. So I think pretty much any physical therapist you're going to talk to is familiar with, prescribing and giving people home exercise programs. And while there are a lot of, companies or I should say websites or whatever it might be where you can prescribe exercises and it might be the honor system of, hey, did you do them? There's really not much tracking that goes into that. And I think that really right now we're kind of on the forefront of realizing that there are gaps in what we're able to do right now. And a lot of, these tech companies are coming to us with ideas of how we can truly do remote therapeutic monitoring. And I can only speak for myself and my hospital system. It's one of those things where we see the benefits that it could bring and we understand the ideas and how this could be a great benefit to the patients and to their outcomes. But I can't really say that I've used it a lot yet. And I do think that is a challenge sometimes with being in a huge hospital system is that sometimes we're not the earliest adopters when it comes to new billing practices. I'll say that's one thing that we just haven't explored, but it doesn't mean that we don't realize the potential that it has.
You're probably hearing about from your peers or from the industry elsewhere about RTM and things like that, right?
Yes.
And we certainly believe its value, but we also see a fair amount of misuse, if you will, which we hope doesn't impact the overall program itself. Back on telehealth, what use cases do you see today? Now we're past the COVID, right? It's been a few years down. Certainly from a use case standpoint, as it relates to rehab, PT, or even your sports or athletic use cases.
Yeah, so it's much easier to speak from what I've either personally done or I've seen done in my clinics. So at times, even the initial evaluation, sometimes through a telehealth, can be very beneficial. If it can be challenging for people to either accommodate times on your schedule that they can come in. So in other words, if someone works 9 to 5 and most of the availability we have is in the middle of the day, it might be easy for them to jump on like a virtual telehealth call, at their lunch break. So that's something that we do at times through telehealth. The other thing that we tend to do is we do see a lot of athletes. And a lot of times we don't necessarily need them to come in to discuss, hey, what questions do you have? How are your home exercises going? So a quick telehealth visit is a great way to just check in with a patient, make sure they don't have any questions about their exercises, they aren't having any issues, providing progressions or some advice on, hey, how can you get back into a certain type of practice or certain movement. So I would say those are the ways we're using telehealth the most right now is, either the initial eval to kind of screen some things out for those people who maybe can't get in right away, or just follow up with some of our athletes if we know they're already doing well and we might just have some questions and things like that with them.
It's those quick touch points, and that also fits in beautifully with the whole remote therapeutic monitoring circumstance. So switching topics a little bit, at Band Connect, we've seen tremendous engagement from the patient, the clinician-patient engagement, driving sort of a compliance with home exercise therapy and the like. One of the things we observed is that a more engaged patient and a more compliant patient sometimes also drives behavior change on the PT side or needs behavior change, right? So, because the in clinic experience can now dramatically change to being more analytical as opposed to just going through the therapy services. We've seen PTs adapt at various levels to that. We'd love to get your thoughts on how we can approach that conversation with the PT, particularly as it relates to the topics.
Yeah, I mean, so I think there's a lot of different paths you can go down with this, conversation or benefits. I think one of the first things that really comes to mind is, a lot of times we're prescribing exercise to patients and, they come back in for their PT visit. Let's just say it's once a week. So the next week they come in, we ask them how their home exercises went. You hope everyone's honest with you, but you probably have some people that say, "Oh yeah, I've been doing my exercises," and you don't really know if they were. And they come in and they're stiff or they didn't make the progress that you'd expected, with the exercises you were giving. And it kind of creates this feedback loop for yourself of, all right, do I need to change the exercise I'm prescribing? Because clearly what I'm giving them is not working. But at the same time, it could just be that they weren't doing the exercises, which is why they didn't make any progress. So I think by improving that compliance and being able to track, if they are actually doing their exercise can be super beneficial in the sense that if I know they're doing their exercise every single day and they're putting input on, hey, I'm having pain during this, or I'm not, I don't feel like I'm doing this comfortably, then I know I need to change something because clearly what I gave them is not working. And it also might help prepare you when they come in. If you look and you see they've done everything and they come in, they say, I feel great, I'm making great progress, then you know, hey, I can push things a little bit further because they've been doing their own exercise, they feel good, whatever the case might be. So, in other words, it's kind of just setting that foundation when they come in and kind of helps me make decisions on how I need to either progress or regress their exercise program.
Yeah, that's awesome. Like I said, it's been definitely a learning experience for us, and we're trying to incorporate that some into our onboarding experience, if you will, with the technology, with the PTs. But I mean, they're pretty good at what they do. It just helps us to sort of orchestrate and build a direction or a pathway forward. All right, this might be fun for you. At the Druzinsky Sports Institute and also your affiliation with the Haslam Sports Innovation Center, you have the opportunity to evaluate a range of different innovations, right? Both in clinic and beyond. What are some of the things that you've come across that excite you? You don't have to name names if you're uncomfortable, but love to hear more.
Yeah. So, I mean, I think the biggest thing that I've noticed is that there's a lot of tech companies out there solving problems that we didn't even know that we had necessarily, or they solve problems that you never thought you could, right? So, you
Yes.
know, we're really able to put tech into everything, it seems like, whether it be in shoes and sensors, whether it be, cameras, AI, all these different things are just going to help continue to give us more information. And that information is hopefully going to lead to us being able to make better decisions. Again, this doesn't just have to be in the rehab PT realm. It can be better decisions for injury prevention. It can be better decisions for athletic performance. Whatever it might be, we're just getting a lot more data. And if we know how to use this data, it should really be able to help set us up to make sure we're making better decisions going forward.
Any specific technologies that really excited you the most?
I want to say there's like one, and I mainly don't want to, I don't want it to seem like, hey, one specific thing is going to change the way we do everything. But I guess the one thing I could talk about that as technology has already been out for a while that the good example that's changed the way we do a lot of things is there's a lot of different companies that use force plates or different types of sensors that give you input on force output. And that's something that there's not one company, there's many that do it. But it's really been one of those things that we've incorporated a lot into our rehab. And not just in our rehab in the sense of trying to make someone stronger or change the way they're moving, but also our decision making on how much is someone close to back to typical movement quality. So, in other words, I might be able to look at you and say, hey, I think you're landing equally on both sides. I'm slowing a video down. I'm trying to look at things, draw lines. But when we look at different like force plate markers, it's picking up very minute changes that I wouldn't be able to pick up with my eye. And it's
Sure.
very data driven decisions, which kind of helps us determine, is this athlete ready to return to sport? Or if we're doing assessments on healthy athletes before a season, you can see some people who maybe have poor landing mechanics, or you're like, hey, you tend to land like 20% more weight on your right leg than your left leg. And then the athlete says, oh, yeah, I sprained my ankle like 6 weeks ago. And you're like, okay, well, that makes sense on why you're landing differently now. So that's one example of technology that wasn't there. I didn't learn about at least when I was in school, that now is starting to get incorporated more and more into PT clinics, and we see the benefits of it.
Yeah, I mean, I certainly see that as an advantage with the sports and athletic use cases that you have to get exposed to some of these innovations and potentially going forward also apply them to more routine orthopedic rehab as well. I think one of the things that we have observed in the many years that we've been doing this at Band Connect is that, the consistency of having objective data to make decisions, right, is not always there. And so we worked hard to try to deliver that as best as possible. And I think you were the one that quickly recognized the value of us being able to measure strength of force, right, through our resistance bands. That's cool.
That is something that we do in the clinics now, with some of our technology that we have. We're trying to look at that stuff because again, the old way of doing things in school when you're in PT is manual muscle testing, and that's just you
Right.
against me and me making a judgment call on how hard you're pushing. And a lot of times, we actually need to be able to track that information through that.
Yeah. So the other end of the spectrum is there's also things that are hyped or overhyped, as the case may be, and anything that you can talk about in that direction, right? And this could be also something along the lines of where you expected value and didn't quite see that map out to the extent that you wanted. So,
Yeah, so I mean, I think it's an overarching thing right now with all the tech that's coming out, right? And all the companies and all the different things that we can do is it's great to have all of this data, right? And there's a lot of assumptions we can make, and there's a lot of things that we've already researched and know what data points we want. But at a certain point, we're going to have so much data that's going to be sifting through what information is beneficial versus what isn't, right? So, you can give me all the data in the world, but if I don't know what to do with it or if I don't know what's important, then that's not really going to help me make better decisions. And I think the other thing too is, we're very fortunate at the location that I'm at that we have a ton of different equipment and resources, but you also still only have so much time in a day or so much time with the patient that trying to figure out what are the best tools for this specific patient, right? I'm not going to be able to use 50 different pieces of equipment on someone in one day. So trying to figure out, hey, what is going to give me the most value? What is the most specific towards either this patient's condition or their athlete that they want to athleticism that they want to get back to? So I think that's kind of the overarching thing right now is that figuring out what data points we want, what mix of data and functional tests and things that we want, and not to throw all your eggs in one basket because I don't think you can paint a picture of someone's performance if we just look at one thing.
absolutely. The dissection of all of the available data is becomes an increasingly important aspect with all the tools that are available. I'd love to hear more about the Haslam Sports Innovation Institute and the work out there. I think one of the pillars, if I remember right, is around driving healthier athletes, right? And some of the work that you're doing there. Anything that you want to share there?
So, I mean, I think this is a unique, partnership and relationship that we have through that in university hospitals, in that really some of the goals of the Haslam Sports Innovation Center is to find startup companies that we feel like can make a difference, right? That can make a difference for, our patients. And we tend to have the lens of the athletic patient or the athletic population just because that's really where our sports medicine department is looking at. But not only is it, hey, what companies do we think can make a true difference, but how can we help them make a difference? In other words, like how can we as physical therapists and physicians help provide input on what things do we need to help them and then help steer them as well as just with research, has been a great, you know, has been a great ability for me to realize, the impact that we can make. So in other words, if a small company comes in and says, "Hey, we have this great idea," but they don't work in, the physician or the performance or the rehab realm, sometimes, you can be the smartest person in the room and know everything about engineering, but you can't realize how is that going to correlate to being in an actual PT clinic. We can sometimes bridge that gap, and it's allowed me to kind of see with some of the research that we're doing how we can make a difference for our athletes, for our patients.
So one of the areas that I wanted to dig into, and I think you've already addressed this, is your interest in ensuring there's evidence or clinical evidence based on the products that you're looking at. And it seems that it's pretty high, right? Particularly as you're dealing with the orthopedic surgeons in and around you. We've at Band Connect have several IRB studies ongoing, and fortunately, we have some data now. It's been a long process, but fortunately, we have some data now that we have started to present at certain orthopedic forums. And we certainly believe that it's because there's a lot of tech out there, right? And some of it actually creates noise than otherwise, and we want to add to that spectrum as we think forward. So thanks for your perspective on that. On a broad question for you, and what is one commonly accepted practice in rehab that you believe needs to be challenged or needs some rethinking?
Yeah, one thing I do think that we are making strides and improvements on it, and I think we do a really good job of it at UH in our locations, but I think as a whole, rehab is getting better at is kind of progressing people based off time or giving somebody time allowances on, hey, you can return to activity after your surgery after 5 months or 6 months, or just kind of putting that on it instead of looking at specific criteria. So that's one thing that we kind of push now, is that we are trying to progress people based on hitting certain benchmarks or criteria, and time is a component. So in other words, we're not going to go too quickly through it, but just because you're 16 weeks out doesn't mean that you can do X, Y, and Z activity, because if you don't have the prerequisite strength or motion or swelling or whatever it might be, then we're not going to move you to that next goalpost. Whereas I do think, before, ACL is probably the easiest one. I mean, there used to be a time where 6 months was the cutoff. There really wasn't much thought about it. It's like, hey, after 6 months, you can go back to your normal activity. And I think that, over time, it became much more about criteria. And then as we've realized that we're starting to put more criteria out there and do more research, we realized 6 months is too soon. And now we're kind of more towards the 9 months. And I'm sure as we do more research and all that, that timeline might change again. But I think the really important thing to remember is a lot of times we're really trying to make sure they are passing various return to sport protocols, which aren't just, strength measurements or range of motion. It's also looking at functional aspects in terms of how somebody moves, how someone jumps, their landing mechanics, their force outputs, things like that.
And it sort of also ties back, right, Brent, to the objective data that you're talking about, right? All these different tools that you have to measure all kinds of different things and applying it almost from a goal setting standpoint, both desired and achieved.
Yeah,
That
100%. I
that
mean, I
sort of
think
ties.
I think the data aspect is really important because, one, a lot of times I think we tend to give ourselves more credit than we probably should, in the sense of thinking that we can see everything without data. So my point being, the simple test of having somebody do a counter movement jump, so jump up in the air and land. A lot of us think that, hey, I can take a video and I can assess and I can say, yeah, they're landing the same or they're jumping off the same. But if you put every single person on force plates, that's going to give you different data that you're like, man, I didn't even realize that they are landing more on the right side, or they're landing fine, but they're pushing off more on their left, or whatever it might be. So I think that's where, getting more data instead of it just being, a subjective opinion on where someone's at is very important. And the other thing I think is important mentioning is we're still not perfect. Even though we do have, different testing that we're doing, there's still people who have recurrent injuries. And while some of that might never be able to be controlled, if it's a contact injury, some of you just can't control what happens. But there's still a lot of non contact injuries that happen, or repeat injuries, that, maybe if we had more data points or we had different testing protocols in place, we'd be able to make better decisions about when someone's truly safe to go back.
I was quite amazed to learn about the 33% recurrence rates for ACL reconstruction, right? I mean, so to your point now, I mean, if we use our innovations to bring that number down, we're doing great. We may not get down to the level that we all want, but we can certainly make improvements, right?
Yeah, absolutely.
And use more objective data out there. So the same question, but from us as patients, I fall into the patient category here. So what should we as patients be thinking about, asking our PTs, or is there anything else that we should be doing as we engage in physical therapy? Because I know that there's all kinds of profiles of people like myself.
Yeah, I mean, I think the biggest things, if you're a patient and you're in physical therapy, I think it's just communicating with your therapist. I'm not saying that you need to check in every single day, but I mean, when you have an appointment, maybe keeping a log of how well you did with your exercise. Did you do them all? Did you have any issues with them, whether that be pain or, hey, I don't actually know how to perform a certain exercise? Because a lot of times we can't obviously be there with you. We don't really know what's going on when you're at home. So that first 5 minutes when you walk into a clinic, and we're asking you questions, hey, how have your home exercise been going? How are you feeling? What's new? That can give us a lot of information. If you just come in and you say, oh, everything's good, but in the back of your mind, you're like, well, I haven't actually done anything. It's been a busy week or whatever it might be. That's not as helpful as if you walk in and you just tell me, like, hey, it's been a really busy week. I didn't do my exercise at all this week. I'm going to do better about it. And then I can kind of do a quick reassessment, see where we're at. And I might say, hey, Rohit, you actually look pretty good today. So keep up with your exercise, but we're going to progress things today in clinic. And then when you come in, after you've done your exercise this past week, then we'll progress it more. But yeah, I just think that communication is important and being honest. We're never going to judge you because you either did or did not do your exercises. Obviously, we want you to do them because if you're seeing us for shoulder pain and we're giving you exercise, our goal is to make your shoulder pain go away. But at the end of the day, if you're not going to do your exercises, like you're the one that has to live with the shoulder pain. So at a certain point, hopefully you take our advice and allow us to help.
Yeah. And you know this. That's what we're trying to do at Band Connect, right? So address all the rationalizations that people like myself use, right? And make it simpler, make it easier, and make it data driven, right? Which we think, will drive most people to do what they're supposed to be doing. So yeah, it's a journey, right? And we're all very different in terms of what we do and how we do it. So
Absolutely.
all right, some quick rapid fire type questions as we try to wrap up over here. A trend in rehab that excites you, and you can call it sports medicine too.
I would say right now that there's been a lot more emphasis and focus on strength training. So, not being as passive with you using modalities or, obviously I think manual techniques have a place and I think they're very important, but I think we've started to move towards more active therapy. So actually having people lift weights and improve their strength versus just being passive on a table. I think that's something that really excites me right now.
So simple question, a trend that worries you.
I mean, it doesn't really relate to anything we've talked about, but I do feel like, insurances can sometimes be very challenging to navigate. So, in other words, they can change year to year or change the amount of approvals they give. And this might affect, me more than someone who works in a cash-based service. Obviously, it doesn't affect them. But the more challenging that it gets to get people approval for visits, the more challenging it is for us to make people better. So I would say that's a trend that I don't want to see because I think it's going to devalue a lot of what, insurance-based PT clinics can give you. And then all of a sudden it's going to turn into a more cash-based service, which is harder on the patients.
I'd agree with that. And a lot of behavior is driven by reimbursement, right? On all sides of the equation. One of my hopes and goals, if you will, is that by generating objective data about patient recovery pathways, the whole reimbursement model changes for the better, right? Because right now it's arbitrary. One can say, oh, well, I don't really know, right? Because you don't have the data and so on and so forth. And better outcomes, better tracking, better data should should change the equation that we have with payers. Hopeful. If you had a remix, since we call this session Rehab Remix, about one of the things that we do with rehab today, what would that be? So in terms of a change or adaptation, that's really what it means.
It's a good question. I'm trying to think of what comes to mind. It's like what would I change with rehab today in a sense? I don't know. I don't know. And I just mean that because I'm just trying to think in my personal experience something you don't like. So I'm trying to think of something that I'd want to change. I think for the most part, I mean, outside of, I guess the biggest things is it's going to depend on what your personal experience is and where you work and who you work around, right? Like I've always been very fortunate to work around very driven physical therapists who use evidence and stayed up to date on the latest research and things like that. Whereas I do know through different clinical experiences or through talking with friends that there's some environments you might go into the PT clinics that kind of are there more for the business aspect versus, trying to be the best clinicians they can and try to use the evidence. So I guess if I could, I would want every PT clinic to be evidence-based and be driven and not necessarily just be a business model.
I mean, I think there feels to be a lot of moving parts, right, in the system today in terms of what's working, what's not working, what are the motivations, not just on the clinician side, but on the patient side as well, right? That takes us to where we are today. We see a fair amount of opportunity for making a difference, and we certainly appreciate your role in that as well. So, well, Brent, thank you for putting up with me.
Absolutely.
Thank you for taking the time to
Come
chat.
on.
Thank you for taking the time to chat. This was fun. I enjoyed the discussion. You've been listening to Rehab Remix Reimagining Boundaries, produced by Band Connect. Please follow us and subscribe to our Band Connect channel. I'm Rohit Nayak. Join us next time as we continue our journey together for what we like to call our hybrid rehab revolution. Thank you, Brian.
Thank you.